Nutmeg is one of the most misunderstood spices in the kitchen. Some people call it a brain booster. Others say it helps you sleep. And online, you may even hear dangerous claims about nutmeg being a natural drug. So today, let us slow down and look at nutmeg properly. What it actually does in the human body. What science supports. What is exaggerated. And how to use it safely and intelligently. Nutmeg comes from the seed of Myristica fragrans. It contains bioactive compounds such as myristicin, elemicin, safrole, eugenol, and lignans. These compounds are biologically active, but dose matters a lot. Now let us begin with the strongest clinical evidence. First, digestive health. This is where nutmeg has its most consistent human evidence. Nutmeg has carminative and antispasmodic properties. Small clinical trials and traditional pharmacology studies show it can reduce bloating, gas, and mild gastrointestinal discomfort. This effect is linked mainly to eugenol and volatile oils that relax smooth muscle in the gut. Second, sleep quality and mild anxiety. Nutmeg has mild sedative effects at very low doses. Animal studies are strong, and limited human observational studies suggest nutmeg may help with sleep onset when used in food quantities. This is not a sleeping pill effect. It is gentle and indirect, likely through modulation of GABAergic activity. Third, pain and inflammation. Nutmeg contains compounds with anti-inflammatory and analgesic properties. Human data are limited but supportive, especially for mild musculoskeletal pain when nutmeg oil or extract is used topically. Oral evidence is weaker but still biologically plausible. Fourth, insulin sensitivity and metabolic health. Some small human and pilot studies suggest nutmeg may modestly improve glucose metabolism. This is not a diabetes treatment. But it may support metabolic health as part of a broader dietary pattern. Now let us be very clear about what is overstated or unsupported. Nutmeg does not detox the liver. Nutmeg does not cure depression. Nutmeg does not improve memory in healthy adults in a clinically meaningful way. And nutmeg should never be used for psychoactive effects. High doses are toxic and dangerous. Now let us talk about dosage, because this is critical. From human and pharmacological reviews, safe culinary intake is typically 0.2 to 0.5 grams per day. That is roughly 1/8 to 1/4 of a teaspoon of nutmeg powder. For standardized aged nutmeg extract used in supplements, clinical ranges discussed in reviews are usually 600 to 1,200 milligrams per day. Standardized for low myristicin content. Now let us translate that into practical equivalents. 1/4 teaspoon of nutmeg powder is about 500 milligrams. One whole nutmeg seed weighs about 5 to 7 grams. That means using more than 1/10 of a whole nutmeg in one day is already excessive. Never consume whole nutmeg seeds at once. Never exceed culinary doses. Now let us compare different forms of nutmeg. Raw crushed nutmeg. This retains the full volatile oil profile. It has the highest aroma and strongest biological activity. However, compounds degrade quickly after crushing. Nutmeg powder. Convenient but less potent. Volatile oils are lost rapidly during grinding and storage. Health effects are milder and less consistent. Aged nutmeg extract. This is standardized and safer when properly formulated. Unstable and toxic compounds are reduced. More consistent dosing. Best option for supplements. Cooked nutmeg. Heat reduces volatile oils like myristicin and elemicin. Digestive benefits remain. Neurological effects are reduced. This is the safest form for daily use. Now let us talk about bioavailability. Nutmeg compounds are fat-soluble. Consuming nutmeg with healthy fats improves absorption. Examples include olive oil, yogurt, milk, or nuts. Synergistic foods include Black pepper, which enhances absorption. Cinnamon, which complements metabolic effects. Ginger, which enhances digestive benefits. Now let us discuss pharmaceutical interactions. Nutmeg may interact with sedatives and sleep medications, antidepressants, especially MAO inhibitors, anticoagulants at high doses, anticholinergic drugs. If someone is on medication affecting the nervous system, nutmeg supplements should be avoided unless supervised. Now, side effects and populations who should be cautious. High doses can cause nausea, dizziness, confusion, palpitations, and hallucinations. Pregnant women should avoid medicinal doses. People with psychiatric conditions should not use nutmeg supplements. Children should only consume nutmeg as a food spice. Now, preparation methods. Nutmeg can be used freshly grated into food, infused in warm milk, used in soups and stews, baked into foods, as a standardized extract supplement, or as a diluted essential oil for topical use only. Never ingest essential oil directly. Now, what should consumers look for in supplements? Clear standardization. Low myristicin content. Third-party testing. Transparent dosage. No proprietary blends. Proper aging or extraction method stated. If these are missing, avoid the product. Now let us bring this together. Nutmeg is not a miracle spice. But used correctly, it supports digestion, relaxation, and mild inflammation control. Its benefits are real but subtle. Its risks are real if abused. Respect the dose. Respect the science. If you found this breakdown helpful, like the video. Subscribe for evidence-based nutrition content. Share this with someone who loves spices but values their health. And follow the channel for more deep dives into food, science, and smart living.